As we wrap up August, which is National Wellness Month, of course, we had a wellness watch by the Digestive Health Institute. So joining us today is Dr. Lee Allen, returning. How's it going?
Hello, good to see you again.
Yes.
And to you all out there.
Yes, exactly. And today we're you're walking us through a little bit about the impacts of colorectal cancer.
Yes.
So let's begin by talking a little bit about what is it?
Sure. So colorectal cancer is actually the third largest cancer in America. And essentially what it is an abnormal, it starts as abnormal growths of tissue. And essentially those growths, often called polyps, is what you might hear the term is of. And essentially those polyps, if they are left long enough in your colon or in your rectum, can grow into a cancer. So essentially colorectal cancer is a cancer of the colon or the rectum.
Gotcha. So when should someone get screened for this?
That's a perfect question, especially since in the last 2 to 3 years, it's actually changed. People used to hear, oh, 50, happy birthday, you need to go get your colonoscopy. Well, let me make sure that everyone knows it's actually age 45 now.
Okay.
So happy 45th birthday. You need to come on in and get your colonoscopy or other forms of colorectal cancer screening.
So we've been mentioning that magic number 45.
Yes.
But is that kind of one and done, or is there more work that needs to be done?
I am so happy that you asked that, because sometimes people do come into my office like, I just need the colonoscopy one time, right?
Yeah.
No. That is actually not correct. It really does depend on what we find. If it happens that you have some polyps, it is not a one and done, and we want to make sure that we continue to stay on top of it, because oftentimes if you've grown one polyp, that means that your body and your colon and rectum are telling you that they can grow them again. So make sure that you also stay on top of when they tell you to come back. And if you don't remember, call their doctor's office now.
Walk us through that process, especially to, what does that diagnosis and treatment look like as well when you do get that screening done? Sure.
So let's talk about first the risk. So if you are average risk, that simply means you don't have any high risk features. So let's talk about what are high risk features. That means high risk is if you have a first degree relative, meaning mom, dad, sisters, brothers, or even your own children, who may have a diagnosis of colon cancer or rectal cancer, or even in some cases people who have had advanced polyps where they have to actually have a surgery and they come out and say, hey, that was almost cancer. So those are people who are at higher risk.
Very important when we are talking about cancer like this that is so serious. So we mentioned a little bit those risks, those high risks. So what does that diagnosis look like, and the treatment, if you are diagnosed with this cancer?
Let's say, you come in, we get discovered that actually, hey, you have a colon cancer that we believe. The first and foremost thing is that we're going to want to get our biopsy results back. The second thing is that once we've gotten the results back and it's shown, we're going to want you to quickly get in for imaging to make sure that there are no other places in the body that have evidence or suggestion that the cancer may have spread. The next thing we're going to want you to do is see either a cancer doctor called an oncologist and or a colorectal surgeon, because we're going to want to get the ball rolling, and if we can take it out as quickly as possible, we're going to take that out. And that's what most case scenarios are. We're just going to take it out. If we find that it's maybe in other parts of the body, then we're going to say, hey, we need to do some chemotherapy or some immunotherapies, basically systemic treatments that we give you to see if we can shrink things down and then move on to surgery, or just try to control it with the chemotherapies. And then you're going to be monitored, but I'm going to let you know, the earlier we discover it, the better chance you have.
Yes. Well, thank you so much for joining us and kind of walking us through this process, and knowing that, if that 45 is now the new magic number.
Yes, 45, 45.
45.
If you are average risk, 45. Yes.
So,
happy birthday.
Yes, exactly. And if anyone has any questions, we'll have the information for Digestive Health Institute on our website. But thank you so much for walking us through, and it's in a way that we can all kind of understand it.
Absolutely.
Yes. Well, thank you.